good ones first, thank you. When you're going to adjust the talus, it's going to come out anterior, right? You're going to just come up underneath the talus like this, or excuse me, on top of it, your chiropractic index finger. You're going to stabilize your chiropractic index finger with your thumbs. You're going to push the patient's foot into dorsiflexion. You're going to take out your slack and you're going to shove it underneath like this. If you have the patient back on the table more, which is hard the way he's sitting here, you'll get more stability into that leg when you're doing that. If it has gone anterior and it's gone lateral and you pick that up through your motion palpation when you everted the foot, you're still going to use your lateral your chiropractic index finger of your lateral hand. This time you're going to add some of that eversion when you're thrusting. If it's gone medial, switch fingers over like this. Now you're going to add inversion. You're going to traction, then shove it under. Okay, has everybody got that?
Yep.
Okay, for your navicular, you're going to come right up underneath the navicular tubercle. It's going to fall inferior and medial for the most part. You're going to come up underneath it with your thenar, stabilize the dorsum of the foot, take out your slack with inversion and plantar flexion, shove it up. Same mechanism when you're going to come down to the first cuneiform here. Stabilize the dorsum of the foot. Again, you're going to plantar flex and invert and shove it up. Okay? All right. Let's, I guess, go to the other side of the foot now. When you're going to do the cuboid, you're going to come up underneath the cuboid this way. You're going to use your thenar. Again, you're going to plantar flex, and now you're going to evert, and you're going to shove the cuboid back up. Remember, the cuboid is just proximal to the fifth metatarsal head. For the fifth metatarsal head, we're going to put the patient's foot on the table, the heel. I want you to grab it like this. Keep the heel stabilized on the table. You're going to use your thenar. You're going to come down on the superior aspect because it's going to come up and out, and so we're going to shove it back down. Grab a good hold on the patient's foot like this with your whole hand, and get right on top of the proximal fifth metatarsal head, and you're going to dorsiflex, and you're going to evert, and you're going to shove it back down this way. As far as the distal metatarsal heads, you're going to come up underneath them after you've examined them, stabilize up here on the patient's tibia, traction, and thrust it up. Okay? If it's the first one here, you can do this one this way by coming up underneath this with your thenar, putting your thumb over this way, and thrusting it up this way. Okay? The first, second, and third cuneiform, we're going to do it with the patient laying prone. Now, we've already showed you one way to do the first cuneiform. Another way is this way, and you can use this same technique on the first, second, and third. It's a thumb-on-thumb contact. Make sure you're on there where you need to be, and that's how your landmarks really come in to help you, right? So I'm going to find the navicular tubercle, and I'm going to come just just distal to that to get on the first one. It's a thumb-on-thumb. Keep the patient's foot relaxed. Some people like to plantar flex. I like to keep it neutral, shove. You can go down to your second one and your third. When you're doing that, you should open the joint up by just spreading the metatarsals this way, or the tarsals just a little bit this way, and thrusting through, giving the bone a place to go. Has everybody got that? If you're going to do the posterior calcaneus, stabilize the patient's foot like this, the distal tib fib, and the talus as much as you can. Grab onto the posterior portion of the calcaneus, and you're going to shove it back anterior this way. If it's gone medial, you're going to thrust it with the. If it's come posterior and it's rotated this way, we're going to add some torque. And if it's gone the other way, you're going to add some torque the opposite direction. Okay? Everybody got that? And I know I used my left hand on here. Generally, what you're going to do with the right foot is your right hand. So if it's gone lateral, you torque it this way, medial this way. If it's the left foot, use your left hand. Like this or like that. Okay? have the patient sit back up. We'll do the anterior, medial, anterior, lateral calcaneus. Stabilize the patient's talus as much as you can. Come in, contact this little tubercle here on the medial portion of the calcaneus, and your thrust is going to go. If it's gone anterior and medial, you're going to thrust it straight back, and you're going to add torque to it to shove it underneath this way. If it's gone lateral, you'll do the exact opposite on the other side. Okay? I don't know if there's any more that we learned, is there?